So in this video, we're going to be going over medical director strategy and execution. So if you are in a state where you're required to have a medical director, regardless if you're a nurse practitioner, registered nurse, or a non-clinician, this is going to be very important for you because you want to understand how to go about getting a medical director. What do they do? What do you need to get from them? What do you need to give to them in order to launch your wellness clinic? And so that's what we'll go over in this video. So today we're going to be talking about when a medical director is required, what level of oversight you need, how to find the right medical director, and then how to align and contract with them. So share this course. Let's help more NPs and RNs build freedom through ownership. If you use your invite link, you will get 40% commission on anything they purchase with us through their time of being with us. Also, warning, this is the most important video in the entire course. If you are in a state where you need a medical director, you're definitely going to want to know this information. It's only going to help you in the end. Pro tip, watch this at 1.75x speed. It'll help you get through the video faster, as well as go ahead and start taking the steps you need to take in order to launch your wellness clinic. So let's dive in. So as far as the overview goes, at this stage, your goal is to secure physician oversight if it is required for your clinic. You should already know whether your state and services require a medical director or collaborating physician. If you don't, go watch one of our earlier videos around legal and compliance for your state, and that'll help you get a sense of how you can find that information. Also, this step is about alignment and compliance, not just you filling this role. We'll get a bit more into that here later. The physician you choose will be tied to your clinic's clinical accountability. Keep that in mind. So determine what you need from a medical director. So you want to start by confirming whether your service requires a medical director or a collaborating physician. You want to determine the level of involvement required, such as protocol review or chart oversight. And then you want to clarify your expectations around their availability and responsiveness. And then you should know exactly what you are asking for before reaching out. So again, this is all very important for you to know before you go through the process of trying to find a medical director. What you don't want to do is go into that process of finding one, starting getting in front of people who you want to be your medical director and not having a good sense around what they're going to be doing, what services you're going to be offering, whether you need them or not, what your expectations are, all those things, because they're going to sense that from you. And because they're going to be putting their license up in order to support your clinic, that's going to make them feel uncomfortable if you don't have some really good talking points around what you're looking for in this situation. So again, you want to determine everything you need before you really start this process. It's only going to help you in the end, and it's also going to make the cost that you incur for getting a medical director go down, because again, the less they trust you, the more they're going to charge you to be your medical director. So how to find a medical director. So you want to start by looking for physicians licensed in the state where your clinic operates. So some states have laws around whether or not your medical director can be from sitting outside of your state. Now, there are plenty different medical directors or medical doctors who have multiple licenses in multiple states. So it's kind of two separate things. For instance, I believe in Colorado, your medical director has to be sitting in the state that your clinic is in, while you might have a medical director who has a license for Colorado, but let's say they live in Louisiana, then they are unable to be your medical director in Colorado, and you will be in violation of those rules. So again, it's always easier to find someone who is not only licensed in your state, but also sitting in your state, but at the very least licensed in your state. Consider physicians already working in wellness, primary care, or related specialties. So you want a medical director who's going to be helpful. If you're going to be paying someone every month, at least make it someone that you can call and ask questions about the services that you offer and understand the services that you offer, because they're going to be reviewing your protocols and your charts. And if they have no idea about the services, then just because they sign off on it doesn't mean it's necessarily right. And so you want someone who is going to be able to provide you with feedback, especially in this early process of getting set up, so you make sure that you're complying and you're doing everything you need to do in the state that you're in. So professional networks, referrals, coworkers, Facebook groups, and job listings are common starting points for you to find a medical director. And so you can use all of those avenues and channels to find someone to be your medical director. And so keep that in mind as you're going through the process of setting up your clinic. If I were you, I would get my protocols and templates and everything drafted before looking. But once you do that, you can really start looking. The goal is to find an alignment, not just availability. So a lot about what I was just speaking to around finding someone who knows and has an understanding of wellness, primary care, and related specialties. Again, you want to find someone who is aligned to you, not only from what they know, but also for how they operate. So you want to find someone who's going to work well with you. Y'all are going to be partners, and hopefully for a long period of time, right? If you are a registered nurse in, the state of Texas, for instance, your clinic is going to be open for 5-10 years. You want to find a medical director who's going to be by your side through that whole period, so you don't have to go through the process of having to find another one. So you want to find someone who's aligned to you as well, who supports you, who understands what you're trying to do, who gets your vision, and ultimately is going to be an asset to you and not a liability. So how to evaluate and align with the medical director. So you want to confirm the physician understands your services, the laws in your state, and your clinic model. Again, if they don't understand these things, they're going to be a burden, and it's just going to be checking a box. And so I don't recommend that you find someone who doesn't have an understanding of what you do and doesn't have an understanding of the state laws. They are like a second check, right? We've already done the research at this point. We've already got our stuff in place, and we have a really, really good sense around what our state requires. But having a medical director who can pretty much confirm with you that's their understanding as well is going to only make you feel more confident in the foundation that you have set. And so that's why you want to find someone who truly understands what needs to go into operating this kind of business. You also want to discuss oversight expectations, communication style, time commitment, and in the event that you need to operate an MSO model, ensure they have their entity set up, understand the MSO structure, and are prepared to sign an MSO agreement. So again, if they don't understand the MSO, you're going to have to walk them through it. Now, nothing's necessarily wrong with that. I will be honest with you, the MSO structure is complex and it's kind of a side. And so if they haven't worked within an MSO structure before, they may not know about it. And so there's no issue with you walking them through that, but you want to make sure they understand, they get it, and they're prepared to operate in that sort of structure and are prepared and understand that they're going to need to sign an MSO agreement because of it. You also want to review compensation expectations with them early on to avoid misalignment. As with anything financial, there's sensitivities around it. So you want to be upfront and transparent early on about what you're willing to pay them, and then let them react to that and tell you what they're willing to take as far as being a medical director. You want to avoid informal arrangements that are not clearly defined. You definitely don't want to go off just a handshake. That's not going to cut it. So you don't want to do any type of informal arrangements, and you don't want to have your roles and responsibilities not, written out, because just like we were talking about with the operating agreement and the MSO agreement, that's just not going to help you if anything arises in the future. So lastly, you want to finalize the agreement and clinical alignment related to the medical director. So you want to draft and sign a medical director or collaborating physician agreement. So this is outside of an MSO agreement, for instance. This is an agreement between you and the medical director, or you and the collaborating physician, that again goes through how much you're going to compensate them, how much time is required in their responsibilities, as well as how much you're going to pay them, which we'll get into here in a second. So you want to ensure your responsibilities are there, compensation and the terms are clearly defined. You want to have the physician review and approve all relevant clinical documents. And then this step formalizes accountability and protects you both, right? And so they're going to appreciate this. You're going to appreciate this. There's not going to be any reason that if they want to be your medical director, they're not going to feel comfortable signing something like this unless something in there is not aligned to them, which they obviously need to read it before they sign it to make sure that is the case. So collect credentials and prepare for operations. So you want to collect required credentials such as a physician's license, DEA number, and MPI if applicable. So at the very least, you're definitely going to need their medical license. Whether or not you need their DEA number really just depends. If you're an MP, you're likely not going to need that. You're going to have your own. But in some cases, as a registered nurse, if you are offering testosterone therapy in your clinic, your medical director agrees to that, you may or may not need it in order to do that. So this is a more of a gray area. We would need to go more in depth about that. But either way, that's why I'm calling that out here, just so you are aware of it. And then their MPI number typically as well. These all will help you get, credentialed with your pharmacies, your EMR, and your vendors. A lot of times you may need to use your medical director's information to get set up with those. And what I mean by that is kind of like as a supplement to your information for your business. Even in an MSO structure, your LLC is what's going to likely be on file for your vendors, but they're going to maybe even require your medical director's information in order to send you office-based medication. So again, you want to have these credentials for when it comes up and for setting up these relationships. So you want to store these credentials securely and keep them current. And then this ensures you are operationally ready to now move forward. So key takeaways here: medical director selection should be intentional and well aligned. Clear expectations prevent future compliance and operational issues. Agreements and credentials must be finalized before seeing any patients. And again, I want to reiterate that agreements and credentials must be finalized before seeing any patients. So again, make sure that you are completely compliant with your state laws. And the next step is securing your clinic location and digital presence. So we'll get to talking about that in the next video. So if you enjoyed this course, please let us know in the community. If you're still unsure about things and you want to move faster and avoid costly mistakes, definitely book a call with me. We help with entity setup, compliance, medical director matching, legal and clinical documents, EMR, marketing, and so much more. And yes, you heard that right. We do help you get matched with a medical director. We also provide some other ways that you can also get matched with a medical director outside of us matching you too. As far as interview scripts, we have medical director agreement templates. We have collaborating physician agreement templates that you can use. And so all of that great stuff we can provide to you. So if you get on a call with us, it's completely no pressure. We'll talk about where you are now, where you're trying to go, how we can help you. In the event that we can't help you, we'll give you a few practical steps that you can take right away with your current situation that you can move forward with launching your wellness clinic instead of staying stuck. So schedule a one-on-one call with us below this video, and we'll be more than happy to help you. I'll talk to you soon, and I appreciate you watching this video.